Hello, my name is Nam Jin-woo, and I'm gonna presentation about dental implant. At first, I'm gonna tell you what is implant. Implant is a surgical way to when you have a tooth loss. For example, as you can see, this patient has a serious periodontal disease, so his gums were gone, and he also lose some alveolar bones too. So these patients need to rebuild his tissues, and he have to implant a new, artificial teeth. And at this time, we can use the implant. And many people think the implant is a whole this structure, but this screw part is the implant, and this junction part is abutment, and this white part look like our teeth is crown. And I'm gonna tell you how implant treatment is going. First step is diagnosis. As you can see, if, for example, human teeth is mainly loses by periodontal disease, and as you can see, periodontal disease have many phases, and patients at this phase has such only a little bit of gum recession, but at this patient he lose his alveolar bone too. So we have to diagnose the patient, and we have to make implants to fit their bones too, but we have to make a treatment for that stage. And if we diagnose patient's condition, we installing implants and waiting for healing time. As you can see, we installing implants on alveolar bone, and if patients have serious bone loss, we rebuild the bones. In this case, we take some bones from other parts of bodies, and or use the other medium, so we can rebuild the bones. And after that, we install the implant and wait for healing. It's not just for patient's condition, but we have to wait implants and bones get fit well together. While the bones heal, implants and bones get stuck harder, like putting some glues. So we have to wait for the harder implants. And after we wait for a healing time, we install abutment and crown. As you can see, if we only install the implant, it just came out only to the surface of our gums. But we need to get a new teeth, but not just the implant. So we put abutment, which is a junction of crown and implant. So, and we set a crown on it. So in this process, we have an artificial structure that looks like teeth. And this is, as you can see, implant is very deep, go very deep in our bone, so it's much harder than former treatments. To these two things is structure that make implant surgery more easier. First thing is surgical guide. This marks where we have to implant, but it doesn't only mark the place. As you can see, when we install the implant, it is important to not only to at severe place, but degrees of its implants too. So if we use this surgical guide, we can do more precise surgery, and this is also lose the time of the surgery too. So it is very handy. And using 3D printer, we can make implants or surgical guide much faster. And for it, as I can say, we need to scan our mouth to make some things with 3D printer. So as you can, like this scanner, we can scan our 3D structure of our mouth, and then we can make implants or surgical guide. And when we scan with this 3D printer, we can make that kind of things. So this is my presentation, and thank you for watching.